This is warfarin. It's an anticoagulant that helps blood clots from forming or growing bigger in your blood. It is generally used for people with irregular heartbeats, people that have suffered a heart attack, or people with prosthetic heart valves. Let's take a deeper look at how it's used.
Warfarin is an oral medication that is typically given once a day at the same time each day. The full effect can take 3 to 5 days, so initially it is often paired with another anticoagulant therapy. Throughout the course of treatment, the patient will need to undergo regular blood tests because the nurse will need to monitor blood cell counts, vitamin K values, prothrombin times, and more. This is to ensure that the medication is working properly and not causing any dangerous adverse effects that we will discuss more in depth later. Additionally, this drug is not recommended for pregnant or breastfeeding people, so the patient will have to alert the provider if pregnancy is suspected. The patient will also need to consult the provider before taking any over-the-counter medications, avoid alcohol, use a soft bristle toothbrush and electric razor to reduce the risk of bleeding, change positions slowly to prevent dizziness, and avoid activities that require alertness.
Side effects of warfarin include bleeding, ecchymosis or bruising, abdominal cramping or pain, nausea, vomiting, diarrhea, fatigue, headache, dizziness, swelling, rash, and even fever. Some serious adverse effects to look out for include hypersensitivity reactions, skin and or tissue necrosis, anaphylaxis, jaundice, hepatitis, anemia, hemorrhages, gangrene, and even renal impairment. Sometimes syncope or loss of consciousness may occur. Please contact your provider immediately if you are experiencing any of these symptoms.
Next, we'll discuss administration considerations. Firstly, warfarin changes the body's ability to synthesize clotting factors, so it is important to check if your patient has any conditions that might cause excessive bleeding. These include conditions like bleeding disorders, aneurysms, diverticulitis. If your patient has impaired renal function or impaired liver function, or is of Asian descent, as these may require dosage adjustments to be made. Or any condition that might predispose internal bleeding, such as uncontrolled hypertension, peptic ulcers, or a history of strokes. Warfarin should be avoided in pregnant individuals, so pregnancy tests should be administered prior to beginning drug therapy to prevent risks of fetal harm. Notably, it is important to remember that foods rich in vitamin K decrease the anticoagulation properties of warfarin. Similarly, patients should be cautioned against alcohol use and smoking while taking warfarin, as both impact medication effectiveness. Due to an increased risk of bleeding, a patient may be asked to cease their regular warfarin regimen prior to undergoing surgery. This IV or oral regimen will be resumed per a physician's orders sometime after surgery. Of note, this drug should never be administered intramuscularly due to the risk of soft tissue bruising and hematoma. While receiving warfarin therapy, a patient will have regular PT and INR testing. INR levels should remain between 2.0 and 3.0 while an individual is being treated with warfarin, or in the range of 2.5 or 3.5 if a patient has had a heart attack. Observe caution in individuals who have just started warfarin therapy and in those who have been on warfarin for an extended amount of time, as a bleeding event is more likely to occur. Next, we'll discuss when to call a provider. Individuals receiving warfarin therapy who experience any kind of traumatic injury, but especially a head injury, should be evaluated by a physician at a facility that is able to obtain imaging studies due to the increased risk of internal bleeding. A physician will need to be contacted, and vitamin K will need to be administered if an individual's INR exceeds 4.0, as this could lead to intracranial bleeding. If any of the aforementioned adverse effects occur, a physician may consider discontinuing warfarin therapy in favor of a different anticoagulant. A provider must be notified if there are indications of liver or kidney failure. At this time, they may adjust warfarin doses due to impaired drug synthesis or due to an increased risk of toxicity. Contact a doctor if the patient develops hematuria, hematemesis, melena, blood in the sputum, and/or excessive bruising and bleeding.
Talk to your provider to see if warfarin is right for you. Maintaining our health isn't always easy, but warfarin can get you back on the right track. You don't have to do this alone. We're here to help.